Hello students. So today's topic is menstrual abnormalities. Menstrual abnormalities are disorders affecting the menstrual cycle. They involve changes in frequency, duration, amount of bleeding or pain. So when there will be a change in frequency, means in between a cycle or periods is occurring, or a duration, maybe it's staying for longer than 10 days or lesser than 2 days. Okay, so the amount of bleeding and the pain that will affect, so that is a abnormality of menstruation. Then common among adolescent girls and women of reproductive age, this is very common in them, can affect physical, emotional and reproductive health. Next, moving to the causes. So what are the causes? First is hormonal imbalance, then PCOS, that is very common in adolescent girls nowadays, that is polycystic ovarian syndrome, thyroid disorder, pregnancy related conditions, and uterine fibroids and polyps, stress and excessive exercise. This can also lead to irregular menstruation, nutritional deficiencies and certain medications like having contraceptives or different kind of medication can lead to an abnormal menstruation. Then coming to type of menstrual abnormalities. First is amenorrhea, that is absence of menstruation. Second is dysmenorrhea, that is painful menstruation. Menorrhagia, that is excessive menstrual bleeding. Oligomenorrhea, that is infrequent menstruation. Oligo means less. Then polyamenorrhea, that is more, that is frequent menstruation. And metrorrhagia, that is bleeding between periods, means having menstruation 2 times within a month or within one cycle. Coming to clinical manifestations. Irregular menstrual cycle, heavy or scanty bleeding, severe lower abdominal pain, intramuscular bleeding, fatigue and weakness, dizziness due to anemia, mood changes and infertility in some cases. So this can be the clinical manifestations. Next, coming to the diagnosis. Detailed menstrual history. Before seeing, we have to see the detailed menstrual history. Physical and pelvic examination can be done. Pregnancy test can be done. Due to pregnancy also there can be amenorrhea. Then complete blood count, where we can see the counts and hemoglobin of the patient. Then hormonal profile, that is FSH, follicular stimulating hormone, LH, luteinizing hormone, prolactin and TSH, that is thyroid stimulating hormone. And pelvic ultrasound can be done and endometrial biopsy if indicated. Next, management. So this is a medical management. NSAID for pain relief, that is non-steroid anti-inflammatory drugs can be given. Hormonal therapy, that is OCPs and progesterone can be given. Iron supplements for anemia can be given. Then antibiotics if infection is present. Treatment of underlying disorders, that is PCOS or thyroid disease if it is there, so that can be treated. Surgery for fibroids or polyps when necessary. If it is the case of fibroids and polyps, the surgery is required, so that has to be done. Then what are the nursing management? Being a nurse, how will you manage the situation? Assess menstrual history and symptoms, monitor bleeding pattern, assess pain using pain scale, like from 1 to 10 you will tell the patient to rate the pain. Then encourage adequate hydration and nutrition. Then administer prescribed medication, educate regarding menstrual hygiene, monitor for signs of anemia and provide emotional support. Complications. What are the cases of complication? Iron deficiency. In case of iron deficiency anemia, then chronic pelvic pain, infertility, endometrial hyperplasia, psychological stress, reduced quality of life, pregnancy complications. So these are the complications where you can see the cases of abnormal menstruation. Then how to prevent? So maintain healthy body weight. Obesity or malnourished can also have the problem. Eat a balanced diet that is rich in iron. Regular exercise is important. To manage the stress, we have to do yoga or meditation. Stress should be managed. Avoid smoking and alcohol. Regular gynecological checkups need to be done. And seek early treatment for menstrual problem. It should not be hide, or you should not keep it secret. It should be treated in an early phase. So what we have learned today, that is abnormal menstruation. So abnormal menstruation mainly lead to infertility. It can lead to infertility. So the treatment should be done in the earliest stage so that it should not lead to an infertility stage. So infertility is a treatable condition. Early diagnosis and proper management are the key to treat it. Then a healthy lifestyle improves reproductive health by maintaining proper diet, doing regular exercise, maintaining a body weight, lowering your stress. This will help to improve the reproductive health. Emotional support and awareness are important. You should know to visit the clinics so that it should be treated, and support is also important, otherwise a person can break down. And timely medical care and help achieved parenthood. Thank you.